Cerebral palsy is a condition wherein a newborn baby during the delivery or after the delivery has an insult to the brain. That is, there is reduced oxygenation of the baby's brain, because of which there is a permanent damage to the brain, because of which further the baby has long-term complications such as stiffness in the limbs and milestone delays. If at all a newborn baby has lot of stiffness in the limbs and the milestones, that is at least at the age of 3 months the baby should have neck holding, and then when a baby is made to stand, then it has to land its entire feet down like that in a soft way. If at all the baby goes into a tight spasm and there is tightness in the limbs, that means that there is a definite suspicion of cerebral palsy. Firstly, we take a thorough clinical history of the baby and then do a thorough clinical examination of the baby, that is through neurological and muscular systems. And then according to the severity of the symptoms, we put the baby into a battery of investigations, that is primarily MRI and EEG, and collection of all this data gives you a perfect diagnosis of cerebral palsy. It cannot spread as it is a single point injury to the brain, but it can worsen over a period of time with disabilities in the baby. So early intervention and treatment is mandatory for cerebral palsy. No, there are different kinds of cerebral palsy, that is flaccid, spastic, and also according to the number of limbs that are involved in a baby, it is hemiplegic, wherein half of the body part, that is right head, right hand and the right leg, or the left hand and the left leg are more involved. Or it can be a quadriplegic cerebral palsy where all 4 limbs are involved, or it can be a diplegic CP where lower limbs are more involved and upper limbs are less involved. So according to the stage and the kind of injury to the brain, there are different kinds of cerebral palsy. Yes, such kind of developmental delay or milestone delay might be cerebral palsy. The baby requires a thorough clinical examination and a battery of investigations to diagnose the same. During the process of delivery, because of the injury to the brain, that is reduced oxygenation of the brain, certain motor centers that control the movements of the upper limbs and the lower limbs, that is your hands and legs, get affected, because of which there is too much tightness in the muscles. The baby's speech and intelligence and behavioral patterns also can get affected. So the baby needs an overall examination by different consultants to reach on a conclusion of what all therapies the baby might need. There is a very good chance of the baby having a normal life like any other baby. But that actually depends on the severity of the injury to the brain and how early you have diagnosed and started intervention for these babies. So the baby who undergoes early diagnosis and early treatment has a very good hope of having a near normal life.